Most women adhere to the belief that the optimal method for maintaining health post-70 is through unwavering vigilance, adhering to every test, scan, and screening that promises security. For decades, the narrative has been that vigilance equates to protection, and that consenting to every test demonstrates responsible behavior. This perspective appears proactive, logical, and the intelligent course for safeguarding future years. But what if the clinical reality suggests the opposite? What if, after a certain age threshold, some of the very tests that once provided a margin of safety begin instead to extract a toll on your energy, comfort, and peace of mind? In my 30 years of clinical practice supporting women through menopause, aging, and all subsequent stages, I have repeatedly observed this pattern. Women who trusted the system, who diligently followed every recommendation, who never missed a checkup, yet found themselves trapped in a cycle of superfluous testing. These are patients who sought reassurance but encountered only escalating anxiety, multiple follow-ups, and prolonged waiting periods for results that rarely yielded a significant change in management. Post-50, your body operates under a modified physiological framework. Your metabolism, recovery capacity, and hormonal environment have shifted. Yet, the medical system frequently applies the same diagnostic playbook used for younger cohorts. In this context, what was originally intended as prevention can subtly transform into pressure. Tests that once provided peace now induce fear, and a healthcare routine intended to protect can begin to erode well-being. This juncture necessitates a thoughtful, though firm, questioning of what genuinely serves your current health and what merely perpetuates outdated habits. You retain the fundamental right to seek clarity before consenting to any medical test, to understand the indication, the potential risks, and the quantifiable benefit it adds to your life. Welcome back to the Female Health Podcast, where we uncover the evidence-based truths women need to know, truths that enable calm, confident decision-making regarding personal health. I'm Dr. Lily Stones, a gynecologist and specialist in intimate health psychology. For over 3 decades, I've been guiding women through the hidden changes of aging with clarity and compassion. Before we begin, I encourage you to share your age and location in the comments. I am always inspired by the incredible women who join this conversation globally. Today, we will explore a topic vital for every woman over 70. We will examine the 5 medical tests most frequently ordered automatically. Tests that appear innocuous and beneficial, yet may subtly be causing more harm than good. I will explain their nature, the reasons they become risky after a certain age, and how to engage in a confident dialogue with your physician. At the conclusion, I will share the single most effective question that has aided more of my patients than any test ever could. Stay with me, as this discussion may fundamentally alter your perception of routine medicine, and it may contribute more to protecting your health than another scan will. For many women, the process begins with a routine notification. A letter from the clinic, a nurse's reminder, or a prompt during the annual visit. It is time for your mammogram. For decades, the message has been clear: responsibility dictates adherence to screenings. Early detection is always superior. Consent is the behavior of a prudent, health-conscious woman. But post-70, the reality is not so straightforward. What was once universally considered the safest choice now warrants reconsideration. 1. Reevaluating routine mammography post-75. For many women, continuing routine mammography after age 75 may yield no protective benefit. In fact, it can sometimes precipitate iatrogenic harm, not from the test itself, but from the subsequent cascade of interventions. I have frequently observed this scenario. A woman who is clinically asymptomatic attends her routine screening, expecting reassurance. Days later, she receives a call. Will observed an abnormality. We require further investigation. That single statement can be life-altering. What typically follows is a series of follow-up appointments, an additional scan, potentially a biopsy, and sometimes surgical intervention. When the final histological results are returned, the normality often proves to be indolent or entirely benign, a change that would have never impacted her natural lifespan. The reality is that with advancing age, breast tissue undergoes architectural changes, and these changes can present as suspicious findings, even when benign. The imaging technology lacks the specificity to reliably distinguish between harmless and malignant pathology. However, once a concerning image is captured, protocol mandates investigation. This entire process, the waiting, the testing, the pervasive anxiety, exacts a genuine toll. Current research indicates that in women over 75, mammograms frequently detect cancers that are so slow, growing indolent, they would never have caused clinical harm. Conversely, the subsequent treatments, surgery, radiation, and chemotherapy, carry greater risks of complications and reduced quality of life for older patients, while the survival benefit is often negligible. In many cases, the test generates anxiety without extending life, only increasing worry and medical dependency. This is not a blanket rejection of mammography. It is an empowerment to seek clarity before consenting. Key questions to ask your doctor. Given my age and overall health status, would the detection of an abnormality via this test realistically modify my lifespan? If a small finding is identified, is it more likely to pose a threat to my health or to result in unnecessary stress and intervention? If treatment is indicated, what specifically would that treatment entail for an individual of my age, considering potential complications? These are not defiant inquiries. They are responsible, evidence-based questions. They facilitate a collaborative decision on what truly optimizes your current health, moving beyond protocols established for a younger body. Your primary goal is not solely to detect illness, it is to protect your peace, your time, and your comfort. Remember, the tests that once saved lives at 50 may begin to erode quality of life at 75. 2. Assessing the risk-benefit of colonoscopy post-75. In the next part, we address another procedure many women automatically accept, one frequently performed, but carrying significantly higher risks for older women than is commonly disclosed. This test is often framed as routine. Let's schedule your colonoscopy. The physician suggests casually. You consent, adhering to the standard of preventive responsibility. For decades, this test has been the established gold standard for colorectal cancer prevention. However, what most women are not informed of is that post-75, this same test can quietly transition from beneficial to detrimental. I have observed women enter the hospital for a colonoscopy feeling proactive and prepared. They followed the necessary fasting and cleansing protocols, accepting discomfort as a fair trade for reassurance. Yet, the subsequent experience is often more than mere discomfort. The bowel preparation that was simply exhausting at 50 can induce dangerous dehydration at 75. The sedation that subsided within an hour can now linger, causing dizziness and ambulation instability for days. The colon itself naturally becomes more delicate with age, increasing the risk of perforation or bleeding during the procedure. Medical risks escalate with age. Research demonstrates that for women over 75, the risk of serious complications of perforation, infection, or bleeding is several times higher than for younger patients. Concurrently, the potential benefit, preventing a new life, threatening cancer diminishes, particularly if previous screenings have been normal. If your past colonoscopies were clear, the likelihood of developing an aggressive colorectal cancer at this stage is extremely low. Yet, routine recommendations persist, often because the system adheres to guidelines designed for younger, more resilient bodies, neglecting to consider comorbidities, slower recovery, or differing priorities. Key questions to ask your doctor. Given my age and clear health history, what is my precise, quantifiable risk of developing advanced colon cancer now? If I have a history of normal results, how significantly would another test realistically alter my management plan? Are there less invasive, safer alternatives, such as high-sensitivity stool tests, that can provide comparable screening information without the risks associated with sedation and procedural recovery? These questions are not meant to undermine authority. They foster collaborative, patient-centered care. They remind your physician that you are a whole person whose comfort and quality of life hold equal importance to a test result. The truth is that what protected you at 50 may expose you to danger at 75. Your body has earned gentleness, not unnecessary invasiveness. 3. Caution against overly strict glycemic and lipid targets. Next, we address a silent struggle many women face: the obsession with perfect lab values, blood sugar, cholesterol, and blood pressure. The charts that once fostered confidence can, after a certain age, become instruments of control. Chasing numerical perfection, particularly with certain pharmacologic agents, can subtly introduce more harm than benefit. If you have dedicated your life to health management, you have likely been conditioned to strive for perfect numbers. Post-70. However, this pursuit of perfection can become hazardous. I recall a patient, Margaret, a sharp, organized 78-year-old who diligently managed her diabetes, maintaining her blood sugar below 7.0 is an excellent target for younger adults. One morning, she experienced a syncopal episode, fainted due to iatrogenic hypoglycemia, dangerously low blood sugar, resulting in a hip fracture. Her recovery was prolonged. She stated, "I did everything right, and it still went wrong." This is not an isolated incident. With age, the metabolism of medications is slower, and the body becomes more sensitive to drugs that once provided smooth control, pushing older women to maintain the same tight glycemic targets as younger adults frequently leads to hypoglycemia, dizziness, confusion, and falls. Multiple large-scale studies confirm that overly strict glucose control in older adults increases complications and may even increase mortality risk. The same principle applies to other perfect numbers. Excessively low cholesterol can induce side effects like fatigue and myalgia's muscle pain. Overly aggressive blood pressure reduction may lead to lightheadedness and fainting. The values considered ideal for younger adults are often too aggressive for women over 70. The goalpost 70 is not perfection, it is balance. It is about maintaining sufficient health to live comfortably and confidently without allowing laboratory reports to dictate every choice. Key questions to ask your doctor: what are the safe, appropriate target ranges for blood sugar and blood pressure for someone my age, separate from the guidelines for younger adults? What specific risks are associated with pushing these numbers to the lowest possible extreme? Would a slightly higher, more relaxed target range actually contribute to greater overall day-to-day stability and health for me? Asking these questions is not a refusal of care. It is an active engagement in shaping personalized care that aligns with your body's current physiological state. Staying healthy at 70 is about remaining alert, strong, and safe in the body you have earned, not chasing numbers on a chart. 4. Avoiding the diagnostic loop of incidental findings, screening scans. While chasing numbers can subtly compromise health, an even more deceptive trap begins not with a diagnosis, but with a screen, just to be sure. Test that evolves into a maze of appointments and scans, promising peace of mind but often delivering the antithesis. It often starts with a seemingly harmless suggestion: let's do a quick scan just to be safe. Those words feel reassuring. A scan appears simple: no surgery, no prolonged recovery, just images. But many women do not realize that one scan frequently necessitates another, leading to what I term the loop of reassurance. A cycle that rarely concludes and seldom delivers genuine peace. The typical scenario is this: the initial scan, CT, PET, or MRI, is performed. The report mentions a tiny spot, or something small, likely nothing, but it warrants a check. That phrase, "should be checked," initiates weeks or months of anxiety. A follow-up scan is ordered, potentially a biopsy, and a referral, with each new test leading to the next, until the patient is living between phone calls, waiting for updates that rarely alter the meaningful outcome of their health. The reality is that these scans frequently detect what physicians term incidental findings, small shadows, benign calcifications, or harmless age-related changes. These are not clinically significant, but once documented, medical protocol mandates follow up, regardless of the findings' impact on life expectancy or well-being. A large study in JAMA Internal Medicine found that nearly 1 in 4 older adults who had routine scans underwent additional invasive procedures, yet these procedures offered no measurable improvement in survival. The cost is not only physical but emotional. I have counseled women who spent months in fear over a small abnormality that proved to be entirely benign. They described those weeks as the most anxious of their lives. Every step in the process eroded their confidence. Key questions to ask your doctor before a non-symptomatic scan: What specific symptom or clinical concern are we actively trying to rule out with this test? If a small, incidental finding is identified, would that result realistically change my definitive treatment plan, or would it merely initiate more tests? What are the full risks, physical and emotional, of pursuing findings that may not ultimately impact my prognosis? Asking these questions is a sign of wisdom, not defiance. It is about ensuring that every test you consent to genuinely serves you, not administrative protocol or generalized fear. The healthiest aging women I know are not the ones who consent to every scan. They are the ones who know when to pause, who understand that peace of mind is found not in another test, but in the confidence to decide when enough is enough. 5. Questioning comprehensive, catch, AL, screenings. Finally, we address the test that appears the most protective, the all in one screening, promising to catch everything early. This is often marketed as a comprehensive cancer check or full body scan. While the language is reassuring, this is frequently one of the most unnecessary and anxiety-inducing forms of testing women over 70 face. These broad screenings are designed to find anything that might be wrong anywhere in the body. And this design is the fundamental problem. When you scan for everything, you almost certainly find something. A shadow, a benign cyst, an incidental mark that must be investigated. This initiates the familiar pattern. Follow-up tests, biopsy, potential surgery. Each step adds fear, cost, and sometimes iatrogenic harm, all to treat conditions that may never have posed a threat in your lifetime. I have seen women endure months of emotional exhaustion due to these scans. They begin with a simple scan and end up in a maze of medical appointments and restless nights. Many undergo unnecessary procedures that leave them weaker, not stronger. And the most painful truth is that many of these women were perfectly healthy when they entered the scan, seeking only reassurance. Post-70, true healthcare must prioritize quality of life, not merely quantity of testing. The focus should be on your comfort, mobility, joy, and independence. The factors that make your days meaningful. The final set of questions to guide your decisions. What specific, clinical concern makes this broad, non-symptomatic test necessary for me right now? If a small, incidental finding is discovered, what would the specific next steps be, and would those steps definitively help me live better? How does this test align with my stated goals for health, peace, and overall quality of life? These questions are evidence of thoughtful care. They signal to your doctor that you value a considered approach over routine protocol, and that you understand medicine should serve your life, not dominate it. After 70, it is not about doing everything possible, it is about doing what is worth it. I encourage you to share your age and location in the comments. If you would benefit from a complete guide on medical decision making post-70, including a full list of questioning strategies and safer alternatives, please let me know. Your feedback informs my content. Remember, protecting your health does not always mean adding more tests, more pills, or more appointments. Sometimes it means learning when to pause, when to ask, and when to trust that less really can be more. The strongest medicine is found in confidence, the quiet knowing that your health belongs to you.